Hello and welcome to another edition of Tuesdays with Liz, a Disability Policy for All. Today I have the great pleasure of interviewing Kelly Becklin, who is the Executive Director of the National Council on Independent Living, which is what we're going to be talking about today. So welcome, Kelly.
Thank you, Liz. I'm very happy to be here.
The first question is, how would the new version of the American Health Care Act impact the independent living movement?
Well, the new health care bill, what's called the American Health Care Act, is kind of just the opposite of that. It doesn't really provide health care, at least not to people with disabilities. Like, as you know, at the last moment they amended it so that they can drop any of the stuff in the plans that they have to cover, which means pre-existing conditions would get dropped. They tell you that pre-existing conditions are guaranteed to be covered, but if the plan doesn't cover the service you need, then you don't really get covered. Plus, the thing that really people don't talk about much when they talk about the American Health Care Plan is that it cuts almost $1 trillion from Medicaid. And you can't cut $1 trillion from Medicaid without it just completely devastating people with disabilities. It will institutionalize people, and it will kill people, and it won't kill a few, it'll kill a lot. People think that's overstated, but it's not. Like, I've already had a couple of friends of mine who have died from lack of service because they can't get enough attendant hours. They end up sleeping in their wheelchairs, they get a tuberculosis, gets infected, they get septic, and they die. That's how it works. So lack of service does end up killing people. And people with diabetes, people with asthma, people who get pneumonia, don't get treated, all those people have real potential to die because of $1 trillion being cut out of Medicaid. So this bill will kill people, and it will hurt people with disabilities a great deal, and like I said before, institutionalize a bunch of people. So I'm not sure how that will shake out legally under the Olmstead decision in the Americans with Disabilities Act. We'll have to see if there's any, if it passes, which we're going to do everything we can to make sure it doesn't, but if it does, we'll have to see what kind of legal challenges there can be.
Thank you. And that's really scary.
It is really scary.
The next question is, how would the president budget impact the independent living movement?
Okay, so the president's budget specifically zero funded what we call Part B independent living funds, which Part B are otherwise known as state independent living services. So the money goes to the state. Part C goes to Centers for Independent Living, goes directly from the federal government to the independent living centers. Part B goes to the state, and then the state determines what to do with those monies. There's about 13 different uses that you can use it for: technical assistance, research, that kind of stuff. But one of the main reasons, or one of the main ways it's used, is actually to fund centers for independent living. So, like for instance, New Jersey uses all of their Part B money to fund centers for independent living. So do several other states. So it would close centers for independent living, and as you know, 50% of the staff, 51% of the staff have to be people with disabilities. So it means people with disabilities will lose their jobs, and so it will definitely affect the movement and affect the employment of people with disabilities too.
And if there's no center, people can't live in the community.
They can't get the services that help them live in the community. That's exactly right, Liz.
Can you give the audience an update on the progress of reintroducing the Disability Integration Act in this political climate? We talked to Bruce Darling a few months ago, and gave us a wonderful overview, so I
Oh,
wanted to
great.
ask you.
Yeah. Well, it's been introduced in the Senate by Senator Schumer, and it's got fairly lengthy list of co-sponsors already. Unfortunately, we don't have any Republicans in the Senate that have signed on as co-sponsors, so we really need to try to get more Republicans signed on. And it was introduced by Representative Sensenbrenner in the House. So it's been introduced in both the House and the Senate. Congressman Sensenbrenner is a Republican, so we have bipartisan support for it, meaning that the Republican sponsors it in the House and the Democrat sponsors it in the Senate. And there are already a number of co-sponsors who are signing on. We hope to get more, and that will be one of our big pushes during the Independent Living Conference in July too, is to get more people to sign on. So, but it's a challenging environment, there's no question.
Okay, and if AHCA should pass, which we hope it doesn't, but if it should pass, what does that mean for the Integration Act?
Well, remember the Integration Act is not a program, it's not a healthcare program. It's not like Medicaid or healthcare stuff. It's a civil rights bill. So whatever healthcare system is in place, it will affect because of the civil rights approach to it. So, but it'll affect other things too, like housing, other things that people need to live in the community. If they're not there, that impedes your civil right to be living in the community, which is what the Disability Integration Act does. It gives you the absolute civil right to live in the community and not be institutionalized and have your freedoms taken away.
Okay, thank you. And the last question is, in what way can AUCD and Nickel can work together to make the lives of people with disability better?
Well, I actually think we already have been. Andy and I have been friends since I moved here, and even before that. He's been a great mentor to me. So Andy and I are already working together on a number of issues. And you know, Kim being chair of the CCD, we've also worked together a lot. So I think Nickel and AUCD actually are already forming pretty good relationship of working together on a lot of stuff. Obviously, we need to work together to defeat the American Health Care Act. So that's one area we can work together. And getting the Disability Integration Act passed is another place we can work together. So all the stuff you talked about, or that we interviewed about today, are things that we can work on together.
Okay, thank you. And if you have any more questions about this or any other policy issues, please go to the AUCD webpage and look for this week's in brief. And if you have any more questions about, if you have any questions or comment about this week's Tuesdays with Liz, please leave them in the space below. Thanks and have a nice day. Thanks, Kelly.
Thank you, Liz. Thanks for having me.